So Medicare for All has been gaining a lot of attention during this election cycle. We've seen it brought up as a main topic in the Democratic debate. In fact, you have CNN commentators who are asking a lot of questions, with, of course, establishment right-wing framing, as well as centrist candidates that are using that similar framing. So now Buttigieg, Biden, and Klobuchar, during this past debate on Tuesday, openly attacked single-payer healthcare. They said it was too expensive, unworkable, terrible policy, and their arguments, according to a former health insurance executive, are reminiscent of ones that he helped craft in order to preserve corporate profit and to dupe people into not supporting single payer. So now, there was an article written by Wendell Potter. So Wendell Potter is a former vice president for corporate communications at Cigna. It's a large health insurance company. And he basically, in this op-ed, shares a story about the fact that he came up with many of the arguments, he and his team, and these the companies that he worked for, the groups, I should say, that came up with these arguments that now both the right wing and corporate Democrats are using to attack single payer. So now, let me start out by saying that this was published in NBC News. So that's important, right? Because corporate media, he points out, plays a huge role in stopping any sort of health insurance or healthcare reform, right? So now he says that back when Hillary Clinton, way back in the day when she was trying to do healthcare reform, he began working behind the scenes to help craft a strategy to protect the bottom line of the health insurance industry by manipulating and misrepresenting democratic will so that the public rejected the very policies that would deliver them the reform they sought. Those are his words. Now, he said he worked with the Healthcare Leadership Council. It's a group of CEOs. Well, not a group of CEOs, but CEOs created this group made up of big insurance, hospital, drug, and medical device companies. They formed this group together with the purpose to try to destroy any healthcare proposals that didn't keep the status quo or private insurance involved. They were obviously very successful back then, as Hillary Clinton never got her healthcare plan off the ground. And in fact, she soon after began essentially shilling for the health insurance industry. She was defeated, and now she joined their side. So now, thanks largely to the council's multi-pronged attack, writes Potts, which included lobbying by corporate chief executives and PR efforts to persuade reporters and television news anchors to use the industry's preferred language about the Clinton plan. So they used that back then. So they go to the media and they say, this is the language we want you to use. They say, yes, sir, will do. So the media working with these giant corporations in order to push a propaganda narrative. And so, does that sound familiar? Yes, it should. Because, look, every time there's been a debate, and Medicare for All has come up, it happened in 2016, it's happening now, you have moderators here from the New York Times, CNN, NBC News that ask questions from a right-wing narrative, from a right-wing framing when it comes to healthcare. Now, Potter said that after watching the first 3 Democratic debates and accompanying media coverage, he found that the industry strategy has been more effective in manipulating journalists and pollsters than he could have ever predicted. So understand that, right? So you have mainstream, and they call the media liberal, by the way. What a joke. They call it liberal, and yet here you have industry right-wing talking points that are being used so successfully that journalists just accept it as of course, single payer would never work. Of course. So now this guy, after helping these companies come up with these ideas, he said, I feel compelled to speak up and set the record straight when so many politicians and journalists are using talking points that come straight from Health Insurance Central casting scripts. Now, he continues to write that the industry knows from years of focus group messaging testing that terms like socialized medicine and government run healthcare scare many Americans, and that many of us respond favorably to terms like choice and competition. Based on this knowledge, there were several big lies I helped craft and that are still in circulation today. The first, he writes, is industry propaganda that duped Americans into believing that the free market can work in healthcare as it does in other sectors of the economy. So now I remember right wing commentators would come out and they'll be like, what do you mean? Healthcare? It's like shopping for shoes. No, it's not. Not even close. And it's a ridiculous comparison to compare actual like or laptops. Actually, I think there was someone that said laptops to compare a consumer good to actual healthcare. Those things are very, very different. Okay. And so, no, the free market does not work when it comes to healthcare. That's why you have 45,000 people or more dying from lack of healthcare. You have people that die because they can't afford their insulin. They can't afford their medication. That's why the free market doesn't work in healthcare. It works great when it comes to laptops and shoes and iPhones, and it should stay in those sectors, but not in healthcare and not in education. All right, so now, Potts writes, U.S. healthcare is actually a classic example of market failure. For a free market to function, he explains, consumers need to know how much a good or service will cost them and decide whether to purchase it accordingly. And then he goes on to explain that when it comes to being able to make those decisions, you have to have price transparency. Now, anybody who's ever dealt with health insurance companies and hospitals and how much they come, basically what they charge for certain things, knows that there is no transparency in healthcare. You don't know how much things are going to cost. There's little transparency, and also it varies. It varies greatly among the different providers. Patients also, he points out, lack agency in the treatment that they receive. So, of course, that goes to the whole notion of, choose, right? You choose to have this particular procedure done. You choose the doctor, or you shop around to see how much it's going to cost. Well, he gives the example that an unconscious car crash victim, right? Well, when you're unconscious, you have no ability to decide on procedures being done to you or which caregivers are operating on them, whether they're in network or out of network. So, look, that's a great point. And yet, he points out that when they're revived, they're responsible for the bill. Very important point, destroys the argument about choice, right? What choice does a dying cancer patient have? Exactly. Now, a second argument is that it would result in a government takeover of healthcare. You guys have heard that before. It's a Republican talking point. They've been using it against the ACA for years. Now, it's not, of course, at all true. Now, there's another lie that was put forward by the group called the Partnership for America's Healthcare Future, of which the Healthcare Leadership Council, by the way, is a listed member. They say that Medicare for all is one-size-fits-all healthcare. Well, again, that's not true at all. Potter says the reality is that Medicare for all in the House and Senate would give people more options. That's because, unlike private health insurance, Medicare does not limit the choice of healthcare providers to ever-changing networks of doctors and hospitals. Again, something that I've mentioned before. So you can go to any hospital that accepts Medicare, which would be almost all of them. Not only that, but current Medicare for all proposals also provide a means of budgeting to ensure that all hospitals, including rural hospitals, which, by the way, one of the things in healthcare that is happening right now that doesn't get enough attention is that rural hospitals they don't have enough money. They're getting shut down. Now, on the other side of that, right, you also have hospitals that don't have enough money and are on the verge of shutdown, now suing patients. Every patient, whether or not you have a $2, bill that you couldn't pay, or a $2,000 bill or a $200,000 bill you can't pay. Hospitals have been aggressively suing people because they cannot operate. So now Medicare for All actually makes sure that they're able to stay open by funding them, right? So now finally, there's the other industry lie that Medicare for All would be too expensive and disruptive. The reality, Potter writes, is that the current system controlled and frequently disrupted by private insurance and aided by lawmakers over which they hold sway is the one that's too expensive and unsustainable. Americans, they say, spend more on healthcare than people in other countries because of high administrative costs. That cost, we've went over it before, but just as a refresher, 30% of our healthcare expenditures are a result of administration. Republicans, if you hate bureaucracy, well, then you should really not like private health insurance. Medicare for All, by the way, Medicare right now has 2%. 2% on administration. Now, private insurers, by the way, devote 17% or more of their revenue on average to administration. So now, so now those are the facts, right? Those are the details. So now Potter has a solution to it, right? So one, he urges all journalists, media organizations, and polling companies, but especially politicians on both sides, he says that they have an obligation to drop the insurance industry's framing. He said, there are much more accurate terms that can be used. These include referring more accurately to what Bernie Sanders and Elizabeth Warren are proposing by calling it publicly financed, privately delivered healthcare. So look, it's right. Under Medicare for All, you wouldn't have government-run hospitals. It would be publicly financed, privately delivered. Private doctors, private hospitals. All that would change is who is paying who. And that's it. So again, the whole government-run smear, completely wrong. An absolute lie. Okay? So now he also says this. You should ditch government-run and government takeover language because this isn't what they're advocating, and don't refer to what we have now as a free market system, since it's not. So now I doubt that any of the politicians who are against Medicare for All, who are paid for by the health insurance industry, for example, Pete Buttigieg, who's swimming in industry money, I doubt he's going to go, oh, you're right. Yeah, turns out I'm going to go start using that framing instead. No, CNN's going to continue to use their framing. MSNBC is going to continue to use that framing. All these politicians who are, taking bribes from the health insurance industry, they're going to continue using that framing. Now, what Elizabeth Warren, if she was smart, she would adopt the new framing, calling it publicly financed, privately delivered healthcare, calling it what it absolutely actually is. And so this is an excellent article. Again, this is a guy who worked there, who helped craft these talking points. And he's saying they're all BS. They're all for health insurance industry profit. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know how I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.